Call the Candy County Human Services Committee to order. It is October 6th, 2020, and I'd like to welcome everybody here and also those individuals who may be watching us on YouTube or live streaming it, and thank you for your interest in Candy County government. Commissioners, you all received copies of the minutes from September 15th.
I will move the minutes.
A motion by
I'll
Commissioner
second.
Nissen,
Second.
a second by Commissioner Amon. I'll call the question, or Commissioner Mattson. I'll call the question. All in favor, say aye. Aye. Opposed, same sign. It passes unanimously. And next we have Supervisor Deb Grunwald, and you're going to update us on a policy revision on emergency assistance, I understand.
Yes, good morning.
Good morning and welcome.
Thank you. I'm Deb Grunwald. I'm the supervisor for Canyon County Health and Human Services in the financial area. And I'm coming to you this morning to talk about a policy revision for our emergency assistance program. It's been several years since we reviewed this policy, and given the current economy, we wanted to make a few updates. The emergency assistance program is a program that families and single adults can apply for if they have a crisis, an eviction notice or a utility shut off. And not a lot of the policy is changing. One of the main things that we would like to propose as a change is the ineligibility period as 18 months down to 12 months. Given the current economy, one paycheck can cause people to really get into a bind with their rent or their mortgage or their utilities. And so we would like to change the policy to make that ineligibility period to be 12 months instead of 18 months. As always with the emergency assistance programs, we do have a lot of partners that we partner with, United Community Action Partnership, the Salvation Army, and now with the Candia County HRA to help people who may find themselves in an emergency situation. So we do a lot of referrals, and what has always been a part of our emergency assistance policy is that if they're eligible for emergency assistance, that our help would not just delay an emergency, it would actually resolve the emergency. And so that continues to be a part of the policy. And so really today, the changes are that time period of 18 months to 12 months, and that's really the major change. The rest of the basic eligibility factors and what constitutes an emergency is all pretty much the same. So I would like to have the commissioners review that and give their approval.
Okay. Any questions or discussion?
No, I'll move on the recommended change.
A motion by Commissioner Amon to approve.
I'll
The
second.
revision, a second by Commissioner Imdak. And my only question or comment was this is a revision, been originally from 2003 and updated on a regular basis.
Yes, it's been reviewed every few years. The last one was 2016. I did want to say that we would like to put this policy forward till the end of the year and see how the economy is and how things are, and maybe we can go back to the 18 months if things are in a better situation at that time, but we'll review again at that
Okay,
time.
Commissioner Nissen?
That was my question, that this is a temporary thing.
Yes,
That
yes.
when the COVID
Yes.
thing is over and there's nothing else on the horizon.
Right, and you know, the 18 months was put in place so that we can help families become self-sufficient and not every 12 months apply and get something paid for as an emergency. And so this 12-month revision is just to help during this time period where it's difficult for people.
Okay. No other comments or questions? I'll call the question. All in favor, say aye.
Aye.
Aye. Opposed, same sign. Passed unanimously.
Thank
you
you.
very
Thank
much
you.
for your work on this. And next on the agenda, we have Supervisor Torkelson. And would you come up and share with us information you have? You have a couple of issues you want to, or not issues, but situations you want to talk about.
Mr. Chair, I think you might have skipped a couple
don't have that much time.
to pay the bills and the.
You are from Sunburn,
I
aren't
don't
you?
know.
No. Well, according to my thing,
I've been sending a lot of folks to Sunburn lately to take Highway
Don't you,
104
weren't you
north.
looking at the same?
Just for a
No,
color
I
drive.
am not.
You got yeah. We got to do a
God's
couple
country,
things
you know.
first.
Oh, God, it's beautiful.
Yeah.
I should say allowance of
Before we
the-
move on, I'm working off on a different agenda, I think, that I copied off on Friday. Do we pay the bills today?
No,
No, we don't.
next meeting.
So I
Yep,
am on the right
nope,
agenda.
you're good. Yep.
Okay.
Well, it's just right there.
Well, I'll get on the same agenda, and would you please proceed?
All right.
Okay.
First up, what I have is on our Community Support Program grant. This is a grant that we receive from the Department of Human Services. This is a 2-year grant. The amount of this grant over the 2-year period of time is $615,820. And again, that's over a 2-year period. That amount has been consistent for a number of years, for years and years and years and years. That grant amount hasn't changed. What this grant does is we receive this grant, and then if approved, and it goes through the granting process at the state, then we do a contract out to Woodland centers to provide the community support program that they have to be able to provide services. Some of the things that they provide under the community support program is really looking at client outreach, life skills. They do some group activities. So there's a wide variety of things that they provide with the funding that we present to them. The funding that they receive is $550,000, and then the rest goes to help support our work that our workers do with our serious and persistently mentally ill adults. So what I'm coming to today regarding this grant is just the board's accepting of the grant from the Department of Human Services.
Okay.
So move, Mr. Chair.
Motion by Commissioner Emdak. Do I have a second?
I'll second
A
that.
second by Commissioner Nissen. Any questions, comments, discussion?
I have a question, Mr. Chairman.
Go ahead, Commissioner Amon.
You know, out of the 31-page report or agreement or grant, on page 5, 6.2, on insufficient funds, notification by state to county of canceling. So the state of Minnesota can cancel this at any time if the legislature does not approve funding or decides to cut back on our funding sources. What do we do, and how would we be affected by that? What departments would be affected primarily? What's the biggest impact if they should make a reduction or eliminate the funds?
The biggest impact as it relates to this grant would be the funds that we provide to Woodland centers to provide the community support program. So that would be the biggest deficit that would be occurring, as well as some on funding for the work that we do within the county for case management.
All right, so there is no other agency that would be affected, just Woodland centers?
From this grant, it would just be the
grant.
Woodland centers
Okay, just wanted
and
to
our
clear-
agency.
Just wanted to clear that. And one other question, if I could, Mr. Chairman. On, it shows the brass code. The brass code shows category 434 and 491. What other codes are there? These are all Department of Human Services codes for distribution of funding.
Yep.
So as far as all those other, I'm just curious what the other codes are, what the brass codes are, and what they signify.
They're under this grant, again, just under this grant, there is a wide number of different codes that could be utilized for this grant funding. So that grant funding, maybe it's for crisis center, maybe it is for an ACT team, maybe it's for the CSB program, the case management programs that we do. There's probably 25 different possible codes or brass codes or programs that you could connect these funds to. Mm-hmm. What we have in the Southwest 18 is our Adult Mental Health Consortium grant. DHS puts these grants out as kind of a combined grant, so you can apply for the Adult Mental Health Consortium grant or you can apply for the Community Support grant. And so what we look at across that is what are the grant funds for the consortium going to, and then how do we offset some of that through this grant as well. But there's a list of a variety of codes that you could pick to be able to put some of these funds into. And what we've picked based on a variety of things is the importance of that community support program and how important it is for the clients to be able to have those day-to-day life skills sort of supports. So that's where we've chosen and put the funding at.
And just out of curiosity, is it possible to get inquisitiveness of myself and maybe other commissioners? Could you email us what those other codes signify?
Sure.
Well,
That'd be great. Thank you very much.
If I may, would I be correct? I think BRASS is an acronym for something. I used to remember a long time ago, but mainly it's really for accounting purposes, or coding, to keep track of all
Right.
the
Yep.
money and where it comes in what category. So this has been in process for many years.
Yeah.
So
And that's exactly what that is that for almost everything we do within family services, on the social service side of it relates to that BRASS code.
roads, yeah.
On whether that's case management or it's the CSP programming, on out-of-home placement thing. I mean, it's a wide variety of things has a BRASS code. But what I can do is get you the list of the codes as it relates to this grant. Am I clear on that's what you're looking for, Commissioner, as it relates to this grant?
Yeah, there's 21 codes.
Okay.
All right, thank you. Appreciate that.
Okay. Any other questions? If not, I'll call the question. All in favor, say aye. Aye. Opposed, same side. Pass unanimously. All right. And next.
And I'm up next as
Yes.
well.
Okay.
What Jenny asked me to do is just to give a very brief overview of our mental health programs right now, and obviously as it relates to the COVID issues, as it relates to the way that we're doing business. And so I just wanted to be able to do that and talk through our children's mental health program as well as our adult mental health case management that we're doing. And obviously, thinking outside the box has been the challenge for the last 6 months. And one of the things that we have to look at is, as you guys are aware, there's waivers to us on doing face-to-face contacts. And so we're not required to do face-to-face contacts, but we have learned quickly that that's not the best way, obviously, to do business. And so one of the challenges that we're having is to really look at how do we substitute something for those face-to-face visits, or how do we make the decision of maybe there are some cases that we need to be able to do face-to-face contacts with. And then if we are doing those face-to-face contacts, what does that look like? And how do we make sure there's safety for our consumers, but also safety for our staff? And that's in the children's mental health program as well as the adult program. If we look at the children's mental health program in particular, our caseloads have really stayed very steady, which surprised us a little. We thought maybe there might be a decline in some of that, but they have really stayed steady, and really in the last couple weeks with school being in session, we have seen an increase in the requests for services. And that's not unusual either. Typically in the fall with school, we see an increase in those cases, or requests for services. And so that our caseloads have really stayed consistent. In the beginning, Zoom was fun. It was a little different. It was a little exciting for some of our children's mental health clients, and it was somewhat easier to some degree for families, that instead of going to meetings or doing more Zoom sort of thing. That didn't last real long. It lasted for a while, but it didn't last real long. We have found that is, people are tired of it. And I think in the spring, some of that was you're Zooming for school, you're Zooming for therapy, you're Zooming maybe for day treatment, you're Zooming for case management, and it became old really fast. And so I think that's probably some of the biggest challenge that our workers are having with working with children and with families is that how do you stay connected? How do you make sure that we're working on assessing that risk and working with families in a very different way than we've ever done before? Obviously, with weather changes, that allowed us to open up that ability to do more face-to-face. We're doing yard visits. We're not doing home visits. And that ability to, go for a walk with a client, with a kid, versus trying to do that on Zoom. It's very hard to keep kids focused, some of our mental health kids focused on a Zoom situation. And so we've been able to challenge ourselves to think outside the box, think about ways that we could be doing some of that face-to-face, but maintaining safety for everybody involved. And that has been very successful. And I think that families and kids appreciate that and our willingness to do that. And obviously, families have to be okay with that as well. They need to give permission for us to do that. And we run through the health screening and we do the PPE, all of that sort of thing. Now, obviously, with the weather changing again, we're concerned about that, going back to some of the Zoom, and how do we best continue to think outside of the box? How do we continue to be able to look at how we can meet the needs of the families? What we're responsible to do and what our role is has not changed, but how we do it is what's changed. And it's becoming, obviously, with the changes, it's more challenging for our workers to be able to sort through on how to best meet that need for the families, but then also how to make sure we're keeping people as safe as we can within the constraints that we have. And again, as we look at school starting, we're seeing an uptick in cases or requests for services. Obviously, we're in a situation where we've been doing this for 6 months. The schools haven't. And so I think some of that is us really working with schools and being able to help them to understand what we found to be helpful, working with a particular child, for example, or a particular family, and some of those, and being able to be good partners in that. And I think that's some of what we're really challenged with right now, is to be able to work that partnership. One of our other issues with under children's placements has been the difficulty for placements to open up doors for them, number one, to be able to take new clients, but then number two, to be able to allow for family contact, on home visits. Those sort of things have really changed. And that has really challenged us and the families in that natural progress of trying to get kids returned home. One of the things that you look at when you have a child in placement is, and that child is focusing on their mental health, and they're trying to learn skills, and the family trying to learn those skills at the same time. And what you do is you begin home visits. You begin weekends. You begin to extend that as you work towards that discharge date. Well, we're not able to do that. Placements aren't allowing home visits, aren't allowing kids to go out and then come back in. And what they have opened up is that ability for families to come and do the yard visits and the distance visits, excuse me, some of those sort of things. But we have found that it's getting more and more challenging to sort through how do we best work towards that reunification with the home. Excuse me. So that's kind of some things with the children's mental health. In the adult mental health, some of the things very similar. It's the challenge. What our role is and what our responsibility is has not changed. It's how we do it that's changed. And we're, again, seeing very consistent caseloads. We have some clients who the way we're doing business now is great. They think it's wonderful. There are some maybe antisocial sort of situations, and so they appreciate this, and to some degree some think, hey, this is great, everybody's acting like I'm acting. And so that ability to find different ways to work with them. And then you have obviously your other clients who are not liking this, who want that face-to-face contact, want that ability to have interactions. And again, when you have your therapy and your maybe a group situation and your case management and your doctor appointments and all of those sort of things on Zoom, it just becomes it's just not normal for people, obviously. And so there's lots of changes that happen in our mental health clients along that way. And I think one of the One of the biggest things under the adult mental health that we're going to need to really pay attention to, and I have some real concerns about, are we're seeing closure in adult mental health units on Red River in Grand Forks has closed, or pending closing, I think, 60 or 90 days or something along that line. That's a 70-bed inpatient program. There's talk of some other programs that are concerned about their need to close. Direct care and treatment, which for us is on Anoka Regional Treatment Center, some of our cares, some of our adult foster care homes, on the deficit that the direct care and treatment are dealing with right now is going to have a direct effect on us. And what that will look like for sure, on what the ramifications of that will be, we don't know for sure yet, but I feel fairly confident saying there will be ramifications for us. And so that will be further conversation that I think we're going to need to be able to really pay attention to and sort through is there a way of getting ahead of that? How do we get ahead of that? How do we challenge on decisions that they make? And so I am concerned about how that's going to look in the future. I think across the board for our adult mental health and our children's mental health, when I think about our staff, and obviously our staff still are doing the work that they do and they're doing it really well. But when you're not doing face-to-face, it really takes some of your energy away. I mean, our workers are about seeing people. Our workers are about building relationships. And so that energy takes a toll when you're not able to do some of that work the way we're used to doing that work. And so we're always challenging ourselves about how do we keep that energy up, and how do we think outside the box about the work that we do. So that, like I say, is just a brief update on some of the things that we're dealing with in the children's and the adult mental health. I don't know if anyone has questions or...
Sure. I'll go first, if I may. I guess I can. The question I have with Zooming, have you had any issues that people, because of lack of broadband or computers or whatever, to be able to contact them and stay up to speed on that?
Yeah, we've had some cases in that situation. In some of those, we've done more phone contact than the actual Zoom. We've had in children's in particular, because we have our respite grant. In the respite grant, they allowed us to open on different parameters or eligibility of some of the things. So we have purchased like an iPad for somebody to be able to have more of that interaction and those sort of things. Okay. On hotspots, people try to use their hotspots, but we have had some of those where we've needed just to go with the phone contact versus a Zoom contact. Okay.
The other question is that are the workers able to have more contact via Zoom versus before when you had face-to-face? I'm thinking that...
What I would say on that is that, yes, we're able to have more, and I think the situation has created the need to have more. On that check-in is much more on that ability to having like a weekly check-in versus something that maybe you might have had a monthly check-in before. One of the things, though, that are the challenge too with that is if you're going to a person's apartment and you're trying to assess kind of how their mental health is doing, you can see things. You can see the unopened mail that's building on the table, or maybe the conditions of the home that are building, that can kind of help you to see those signs and begin to have those kind of conversations. That's hard to do on the phone, obviously, and hard to do when you're doing a Zoom. And so I think those are some of the challenge that we're having. And because of that, we're finding ourselves wanting to do more frequent check-ins with the consumers versus maybe we might have done if we were able to go out and do the face-to-face.
Okay. Anything about the waivers? Any comments or concerns? I'm thinking with the waivers from a financial point of view of staff and the agency that we're okay because we do have the waivers and these do count. So we're staying pretty neutral on that. At least.
And that is, at least from the information that Carol's been able to share with us, is that we are staying consistent with our hits what we call it, our monthly contact, and that we're able to get funding for, that is staying consistent because of the waivers that the Zoom or the phone contact is able to substitute that face-to-face.
Commissioners, any other questions?
Well, just to comment quickly, I have some friends in the neighborhood who have a child who requires their services. And for many months now, I've seen an individual sit outside away in the lawn having a conversation for quite a while. And I was curious what was going on. Well, I finally figured it out. My concern is how is this going to change, of course, like you mentioned, when the weather changes, how are we going to maintain that personal contact with that child? Good luck on that one. I don't know if we have to buy snowmobile suits for them or what.
There you go. There you go. We were thinking about buying lawn chairs, but
Yes,
we've
yeah.
moved beyond that phase, and now we're on to snowmobile suits.
Good luck.
But yeah, it will be that, going back to that challenge of how do we keep thinking outside the box, and or what works for one situation may not work for another, and so we're always challenged with how are we going to make this work.
All right. Any other questions from anybody? Well, thank you. Very good update, and
Thank you.
really appreciate all you're doing.
Good to see you guys.
Okay. Yeah. Ashley, we have a Woodland Center update from the CEO of Woodland Centers, and thank you for being here, Ashley.
Well, thank you for having me. So yes, I like to come every year and just give an update on Woodland Centers, kind of where we've been over the last year, where we're headed. And so just going back to 2019, I know we're almost through 2020, but 2019 was a pretty big remodel year for us. I'm sure all of you were aware of our parking lot update. It kind of became a conversation piece in Wilmer because it just took a long time to get done, but it's finished and it was beautiful. It just took quite a long time. The other remodel we did last year, we have an 8-bed supportive housing unit in Wilmer, and we remodeled the kitchens and the bathrooms in there, and part of that was through the Dickman Fund that we have from the Dickman family. It's a charitable contribution that they gave to Woodland Centers, and so we were able to use some of the dollars from that fund to remodel. And it really upgraded everything and allowed the residents just to have a better facility to live in, and it was needed. So that was done last year along with a new roof. And then our big remodel, which was a huge assistance from Kansas County, was our crisis and detox facility. So we received $330,000 from the state bonding grant to remodel our crisis and detox center. It is all completed. We received the check on Monday, so yay, everything's done. I know it's been a process, so thank you again to everybody from the county. It has been a huge endeavor, and it was much appreciated. So. Other things that happened in 2019, we started ARM services, adult rehab services down in Renville County. Prior to us providing those services, those were provided by the Adult Mental Health Consortium. And so we're kind of pulling back on providing services, and we came in and took those services over down there. So we now have, I believe, about 1 FTE providing ARMs down in Renville County. We also hired a new position for us, a director of community impact. And really what this position is about is, as a nonprofit agency, how can we increase our impact in both donations and really getting our name out there. Woodland Centers has been around for over 60 years, and there's still a lot of people that have no idea who we are, what we do. And so Kim Madsen joined us last August. It's been a year. Really in her position to be able to spread the word about who we are, what we do. We've had more seats at more tables now because of Kim's work. She's pulling in grant dollars as well. So it's been instrumental, I think, in helping people understand us. Part of her work, which you'll start to see soon, is a partnership with the YMCA to be able to talk about a health initiative and creating videos about how do we stay healthy during this time of COVID. And so that's coming out this week. So that's just one example of some of the work that she's doing. We also, very good timing, hired a medical director at the end of 2019. Woodland Centers has always had psychiatry services. In 2012 or 2013, we had a very part-time medical director who also provided psychiatric services for us. He left. He was from the Metro and was just coming out a couple days a week, and we never replaced him. So when he left, we got some more psychiatry services, but as the CEO, Dr. Lee before me and myself, we were overseeing the psychiatry department. It worked okay, but we are not psychiatrists, so there's some boundaries there about having a non-practitioner oversee practitioners. And so we felt like it was time that we needed a medical director. So we contracted with Novotel, which is our telemedicine provider, and they provided us with 8 hours a week of a medical director. She's actually from Virginia. She actually visited once right before COVID happened. So she just zooms in 8 hours a week and provides oversight to all of our psychiatric programs, and then also to our crisis and detox facility, because we have a lot of medical components happening in there. And as I said, it was just in time because she got in December, got oriented, and then COVID happened. So it was really good to have somebody with that medical background to be able to help guide us through all these pieces that have happened with COVID and how we're going to respond to them. So that was 2019. 2020, obviously we'll talk more about COVID, but some of the things that have happened despite COVID, we opened a new substance use program out in Chippewa County. We just saw a big need out there. We have a pretty robust program here in Wilmer, but Chippewa County, there's just a hole and they needed more services. So we started that. We are going to work towards Certified Community Behavioral Health Clinic certification. Minnesota is one of the 8 demonstration states for on the national level to be able to offer these services. And Minnesota has decided to make this part of the state plan amendment. So CCBHC will become anybody can become a CCBHC outside of the demonstration is really what that means, and it will become a Medicaid-based payment, and that should be happening this year. So Woodland Centers is going to work towards becoming certified. It's a fairly robust process, but really what it is to be able to offer every service somebody would need under our roof. And if we don't offer it, we're going to help coordinate it to make sure you get it. And then we're going to make sure you're following through with those services. So it's really about that whole care coordination model and pulling in our all of our contacts and our community resources to say, how can we better partner with the county? How can we better partner with the hospital? How can we partner better with law enforcement, and making sure those partnerships stay strong and reinforcing that. So it's a big model, but we're very excited about it. The other thing that happened this year in July and then in August officially, the TriStar ACT team came over to Woodland Centers. So they again were ran by the consortium, and the consortium had decided, we're going to get out of running services, we're just going to help support the provision of services. And so we acquired that team, and that happened in August in the middle of all of this. And overall, I think that's going pretty well. The clients, I don't think, felt any of the changes. The TriStar team serves Renville, Meeker, and McLeod counties. And so we're still kind of working through the transition for those staff and kind of getting used to a new medical record, but overall the transition went pretty well. Some of the pieces that we're working on, we're working on right now with a consulting firm, is open access to care. As I'm sure many of you have heard in your roles here, that access to mental health services is very challenging. People can call and they might wait weeks to get in for a diagnostic assessment. And a diagnostic assessment is what opens the door to all mental health services. And so part of our work, part of what I have felt very strongly about, is we need to eliminate that wait. So we've hired MTM Services, which is a national consulting firm, to come in and help us initiate an open access model of care. So if you call us and you say, I need to get in for a diagnostic assessment, we will say, great, we have an opening today at 3 o'clock. Today does not work? Okay, how about tomorrow? And if tomorrow doesn't work, then call back on the day it does work. We have open access every day of the week. So we will get people in the day they call. And of course, that doesn't work for everybody. I get that, because people are expecting an appointment. So we're going to tell you, call in at 8 o'clock in the morning, we will get you in that day. And then the other piece is psychiatry. This has always been another piece for open access. We are going to implement an open access model for psychiatry as well. So we will not be scheduling out any psychiatry appointments, including med management appointments, up to 3 to 5 days out. So if, the problem is right now, oftentimes I don't know where I'm going to be in 6 months. So we say, where are you going to be, March 5th at 8 a.m.? Well, we want you to be at Woodland Centers for your med management appointment. Well, great, I schedule that, but then I don't show up because I forgot or life happens. So what this model does is it says, we're going to have you come back in 6 months. Here's your appointment card, call us. And if they don't call us, we're going to call them so that they can get in within 3 days of their meds running out. And so there's a whole process. Again, MTM is working with us on this. But it's to eliminate those no-shows. It's to eliminate the wait lists. It's to help with good client care. So it's just an all-around good system. So we're hoping to get that implemented by February is our goal. And then the open access for all outpatient services, we're hoping by the end of this year to have that implemented, maybe sooner. So those are some pretty big initiatives, and that will happen across the center. And it will trickle and have impacts, good impacts across the entire agency. So that's happening. Other pieces that we've been able to do is we started services, well, I say at Ridgewater. We had an agreement to have a person located on campus to provide therapy. Because of COVID, of course, they're not actually on the campus right now. They will be eventually. But we are providing telehealth services to the students and the staff of Ridgewater College. We also have a clinician going into Copperleaf Assisted Living. This started in July. Kim Madsen, our Community Impact Director, received a call from people at Copperleaf saying that the people in the assisted living are struggling. They're feeling hopeless. They're feeling very depressed. They can't have visitors at the time. And so we were able to work out an agreement with them to have our staff person come in and just do a support group. It's not therapy. It's not billable. But we are just going in, offering support, offering help. And then if we're seeing a greater need, then we're referring them for ongoing services. So that has been a lot of the work that we've been doing here in 2020. It's a lot. And then COVID. We can talk about COVID because, of course, everybody's talking about COVID. So when COVID happened here, in March, we were offering some psychiatric and therapy services via telehealth. So we had some experience with it. So the middle of March, we were not sure about the waivers that we had all kind of talked about. We were not sure what services would be billable. Most of our services are not billable without those waivers. But we trudged ahead anyway. So in about a week and a half, every single service Woodland Centers offers, except for our residential crisis and detox, were converted to telehealth. It was a huge lift for my staff, but they did it, and they did it in stride. And so none of our services shut down. None of our services closed. Our capacity has reduced in some services. We're working on building that up. And it took a lot of problem solving, as Corinne was talking about with her staff. It is a lot about working with individual clients, working with family members. We do have folks still in the community doing face-to-face for some services because it's just necessary. Especially for our assertive community treatment team. These are the folks that are struggling to stay out of the hospital. And so they need contact. They need face-to-face. So we have figured out ways to do that. Again, seeing people in their front yard, seeing people very minimally in their home. And now we're having to rethink that, of course, with cold weather coming. We talked about snowsuits as well. What can we do? And so we have created some provisions for our staff to say, if necessary, they can come into our clinic. If needed, you can go into the home, but only for a very limited amount of time. Everybody has to be wearing the appropriate PPE. You have to stay by a doorway. So, all these pieces that we can try to implement as much as possible to not interrupt care, because we do not want to get in the way of people getting the services that they need. So it is a balancing act for all those pieces. What else? So I think that's most of my updates. For 2021, we are looking at just a 1% increase in our purchase of service contract. We're trying to just make sure that we continue to have small increases. We don't have a large one like what we had a year or two ago, but staying within the line of, just increasing costs. So that's that. One of the things we are working on is having some direct access with our Meeker County law enforcement with our mobile team. So it's a pilot model where Meeker County law enforcement will have an iPad, and when they're on a call, they can push a button and have direct access to the clinician on call for our mobile team. So instead of kind of going through this process and giving the number to the person that they're dealing with, law enforcement can really make that connection, and hopefully we can have more calls and keep people out of jails, keep people out of hospitals, things like that, and really intervene right there on site. So we're hoping that that might be a model we can replicate if it works well. But we're going to try it out as a pilot there. So that's my update.
Any questions, comments from any of the commissioners?
I guess I just,
Yes.
if you talk a little bit about Detox, is it, we're not getting as much cooperation from law enforcement as we used to?
Yeah.
And
yeah.
are we working towards fixing that?
Yeah, so with our Detox and Crisis Center, what we've found is that we are not getting as many people on hold orders. So oftentimes law enforcement would bring us folks, or even hospitals would bring us folks that were on a 72-hour hold. Crisis, usually we can get them and we can put them on a hold if it's necessary. Detox is a little bit different because if they are not a danger to themselves or others, we can't put them on a hold. Oftentimes, by the time they come to us, they're fairly sober, or they're not talking about suicide anymore because they're sober. And so those pieces don't happen. So we get them, and oftentimes they're leaving because they're voluntary within 12 hours. It gives us no opportunity to provide them good care. They're maybe not fully detoxed, so we're worried about their health. And then we can't give them follow-up either. We can't offer them additional services. So there's some of that that's lacking. And so we're seeing less bed days in our detox facility because of that. So we have had conversations with law enforcement, trying to figure out how can we problem solve this. We've also talked to hospitals. We have seen a few more come over from Caris Health on hold orders. So I think we're starting to make some headway on that. Yeah.
Good to hear.
Councilor Emda.
First of all, I think a lot of us who are just out civilly every day, trying to stay safe, don't recognize that you and healthcare workers are under more pressure to treat your clients and then to stay safe yourself. And that's particularly true as you're talking about how are we going to do this now as it gets cold. So kudos to you and everybody else who really exposes themselves a lot more than I do in my everyday work. So thank you for that. And I missed the annual meeting because I think the annual meeting was a good way for us to help understand the work that you do, especially when we would hear those testimonials from the folks that had been helped by the services you have. And then a last part, talked about that notification for a 6-month callback. I don't know if you use this or not, but I found it very helpful when my dentist and my eye doctor and whatever sends me a reminder via text that you have an appointment next week.
Yes.
Because it's easy for that 6 month to fall off.
Yep. So we have multiple reminder systems of texting, phone calls, email for folks, and we use all of that as well. Absolutely. We did not have our annual meeting this year, so you didn't miss it. It just didn't happen.
Well, I knew I didn't miss it. I miss it.
Oh, I see what you're saying. Yes. So usually we have an annual meeting where we pull all of our staff together and have a client story, just talking about the services that we do and how it impacted that person. So what we're doing instead is we are actually offering our staff that experience just 1 hour at a time over the next several months. So over the noon hour on Wednesdays, we're going to have a speaker come in and talk about guided relaxation and doing art. And so our staff will participate in that. We have a client that will come over one of those hours and talk about her experience in getting services. So we're trying to do something for our staff because self-care, as you said, our staff are on the front lines. This is stressful. It's challenging. They don't know what's coming next. None of us do. And so we're trying to build in some things too to help with self-care for our staff.
Any other questions? Commissioner Almond.
Thank you, Ashley, for the presentation. You mentioned in your presentation Chippewa County, not trying to pick on them, but delivering a services and you reaching out and extending your service delivery area. How is that impacting, and is it for services that have been reduced in Chippewa County, or participation from their Health and Human Services Department, or how has that affected you? I know financially providing that service. Is there something we need to do as county commissioners to consolidate issues so that we can, or our funds, so that we can attack these issues that you're addressing?
So we started a substance use program, which is, we don't use our purchase of service dollars for that at all. It was really based on a need. Most of the clients from Chippewa County or even Big Stone County, Lackaparra County, either had the option of coming to Wilmer for treatment, which it's too far away, they're not going to come 3 days a week, or down to Granite, which again, it still could be a distance for them. And so we saw it as a need, and we started the program, and it opened in January, and it's been full. We have had multiple, we're full with referrals. And so county-wise, it was really, all that we needed from the county was a letter of support, and we started the program. It's been self-sustaining. So honestly, anywhere we're seeing that need is where we're like, okay, here's a need, how do we fill it? And that was just one of the areas that we saw.
All right, thank you.
Yeah.
An obvious question probably is, how large of an increase, or have you seen an increase in detox and crisis center?
Yeah.
And
Yes.
how do you deal with all that?
Our detox center was much busier at the beginning of this. I think it slowed down slightly. Crisis, surprisingly, residential crisis for adults was relatively slow. Youth side, very busy, very, very busy. And I think part of that was parents were homeschooling, kids were at home all the time, right? And so I think there was just, when there was already some family conflict, it was just increased because everybody's now together. And so it was a lot of just family issues surfacing. And so we did see an increase in our youth crisis. And then detox, we were seeing folks that we normally probably wouldn't see. But I think the stress of COVID, the stress of being home, it has taken its toll on everybody. Yeah.
Well, we've been so fortunate here in Kansas County to have Woodland centers over the years, and it's adapted so well to the needs. When it first started many years ago, we didn't have a crisis center. We didn't have a detox, and we had to take people other places and transport them there if we could even find the services. And you've grown and meeting the needs so well, and yet the needs never stop. And you're adapting so well. We're just very fortunate that the headquarters are located here in Kansas County, and we appreciate that. But also that as a region, we're addressing those needs, and that's so important for not only Kansas County, but for the people in our region. So,
Thank you.
Great job. Any other questions before we ended?
Well, the only other comment I have is we're seeing this change. Could you comment just for a minute? You mentioned many times working with law enforcement. And the roles of our law enforcement staff and how they have to adjust to the changing climate, and adding more social skills to their list of responsibilities they have to do, and the training that has taken place. Are you attacking that in a different area more so than you have in the past? And is it all related to COVID, or is it just an overall increase in that type of a need for our law enforcement people?
Oh, that's a big question. I think for us, it's always been, how do we build that partnership better? How do we work together better? And so with everything that's happening related to COVID, related to social justice initiatives, everything that's happening, I think it's just put more of a spotlight there. And so I think we're always open to how can we partner more? What are those needs? How can we help meet those needs? Whatever the situation is. So, and it is tricky because we're in 7 counties that you have local law enforcement, you have county law enforcement, so it's where do we have the biggest impact, and how can we make those connections? And every city, county is a little bit different in how they want to partner. And so we're trying to meet those needs wherever they are based on what's happening in that area. Yeah.
Okay.
I don't know if that fully answered your question.
Well, no, I just wanted to get a feel for what
Yeah.
your thoughts are on it, because we're seeing things are changing, as Harlan Madsen mentioned many times during the meetings here. it's a moving target.
Yes.
And it very well describes what's going on with our personalities and our climate of our people and the health of our nation. So it's an ongoing struggle. But thank you very much.
Yeah.
Okay. And thank you very much for the update, and we look forward to the next one.
Yeah, thank you for your support.
Okay. We're starting to run out of time. Jenny, do you have any updates?
Just a quick reminder again about the community testing. So the Minnesota Department of Health is working with the National Guard, and they will be here in Wilmer October 6th. So tomorrow, the 7th and the 8th from noon until 6 p.m. This is free testing. The hope is that it'll uncover positive cases earlier, help limit the spread of the disease, and will also provide some data that the state is looking for. And then just another reminder about COVID, we are seeing increasing activity of positive cases in our county. So a reminder to the public to make sure that you're staying home if you're sick, get tested if you're having symptoms, wash your hands, make sure that you social distance and avoid any gatherings where people aren't wearing masks. Wear a mask if you're unable to social distance and you're out. And again, make sure that you stay home if you're sick.
Okay. Thank you. And that'll be it. I hereby adjourn the meeting.